Ever feel like your nursing interviews are, I don't know, more like an interrogation than a real conversation? Yeah, you are definitely not alone. But what if I told you there's a proven strategy that can help you walk into your next interview with total confidence, ready to land the job you really deserve? So, what's the big secret? Well, it isn't just about having the right skills on your resume, it's about how you communicate those skills, especially when you're under pressure. And that right there is the game changer. We're about to unlock the exact method to do it. Okay, so here's our game plan. First, we're going to tackle the biggest hurdle, the behavioral interview. Then, we'll arm you with a super powerful storytelling toolkit. After that, we'll dive into the core nursing themes, learn how to flip the script and ask them the smart questions, and then we'll finish by making sure you leave a killer final impression. All right, first up, the behavioral interview. You gotta know, this is pretty much the new standard in healthcare, and honestly, for good reason. It all boils down to one simple idea. Your past performance is the best predictor of your future success. So what does that actually mean for you? Well, they're not gonna ask a simple yes or no question like, are you a team player? Instead, they're gonna say, tell me about a time you were a team player. See the difference? They want stories because stories provide real, actual evidence of your skills, your judgment, and your character. So if they want stories, how in the world do you tell a great one when you're under pressure? Well, you don't wing it. You use a framework. So let's build your storytelling toolkit. And this right here is where you get a huge advantage. Using a proven framework makes your answers so much more clear, concise, and, this is key, memorable. It doesn't just prove you have the skills, it also shows you're an organized, effective communicator, and that's exactly what they're looking for. Now, you'll probably come across two main frameworks. The STAR method is like everywhere. It's incredibly popular. There's also the SHARE model, which is used by some big names like the Mayo Clinic. It's very similar, but it adds a little extra emphasis on what you learned from the experience. But really, at the end of the day, they're both designed to do the exact same thing, help you tell a powerful, structured story. Our brands are just wired for stories, and these frameworks help you create a perfect narrative. We're going to focus on STAR, just because it's the industry standard, and it's honestly brilliant in its simplicity. You start with a situation to set the scene. Then, the task. What was your goal? Next, and this is crucial, the action you took. This is your moment to shine. And finally, the result. What was the outcome? Pro tip, if you can, use numbers to make it concrete. Situation, task, action, result. That's it. Knowing the theory is great and all, but let's get practical. We're going to apply the STAR method to some of the most common and, let's be honest, toughest nursing interview questions out there. Let's start with a big one, teamwork. I can guarantee you, every single healthcare facility wants to know how you'll fit in with their team, especially when things get difficult. I'm sure you've probably heard this one. They're not just asking if you're a team player, they're asking you to prove it. The second you hear a question like this, your brain should immediately click over to the STAR method. So here's how you'd frame your story. The situation, maybe a disagreement on a care plan. The task, resolve it while keeping the patient safe. Your action, you listened, you found common ground, and perhaps you involved a charge nurse. And the result, the patient received excellent care, and you improved your working relationship. Now notice the key here. You never badmouth the coworker. The focus is always on a professional resolution. All right, next up, let's move to the absolute heart of nursing, patient care. Interviewers need to know you're not just clinically competent, but also a compassionate advocate for your patients. Now, this question can feel a little intimidating, but it is an incredible opportunity. They're really testing your empathy, your communication skills, and your ability to handle conflict with grace. Let's break this one down with STAR. The situation, a concerned family. The task, de-escalate the situation and restore their trust. The action is so key here. You don't get defensive, you listen, you take ownership, and you explain the care plan clearly. And the result? You resolve the immediate issue and you strengthen that relationship, showing you can turn a challenge into a positive outcome. All right, you've expertly answered their questions, but the interview isn't over. Now it's your turn. This is where you go from being the interviewee to the investigator. You have to remember this. You are interviewing them just as much as they are interviewing you. Asking thoughtful, insightful questions shows that you're engaged, you're serious, and you're looking for the right fit, not just any job. First, dig into the culture. Ask about the biggest challenges their nurses face. Their answer will give you a really unfiltered look at the unit's reality. When you ask about management style or how success is measured, what you're really asking is, will I be supported here? Will my work be valued? Next, focus on your growth. Asking about orientation, mentorship, or tuition reimbursement sends a clear signal. You're planning a future there, not just looking for a paycheck. And more importantly, their answers reveal whether they truly invest in their people. And finally, get practical. Staffing ratios directly tell you about the workload. Understanding the shifts, the EMR system, and the chain of command, all of it paints a clear picture of the day-to-day reality, information you absolutely need before you accept an offer.
Whew, we've covered a lot. Now let's bring it all together and talk about how to leave them with a final impression that makes you the unforgettable candidate.
Every story you tell, every question you ask, it all funnels down to the single goal, proving that you are prepared, you're skilled, and you are the exact right fit for their team. And remember, preparing this way isn't just about passing an interview. It's about showcasing your true value. It's proof of your clinical judgment and your commitment to patient care. And this is what powerfully sets you apart from every other candidate. And so I'll leave you with this final thought. You are now equipped with the tools to answer any behavioral question they throw at you. But the real power comes when you listen carefully to their answers. What do they reveal about the job, the culture, and your future? That's how you find not just a job, but the right job.